Hi, everyone. I'm John Kenlon, Senior Vice President at Ensemble IQ and publisher of Drugstore News. I am here with Rina Shah, Senior Vice President, Pharmacy of the Future and Transformation at Walgreens. Hi, Rina.
Hi, how are you?
I'm well, thank you.
Thank you so much for having me.
But we're so grateful to have you. HHS declared the first COVID-19 public health emergency on January 31st, 2020, and on May 11th, just last week, it officially ended. And the World Health Organization also declared an end to the COVID global health emergency on May 8th. So it's over. That's good news, of course, but COVID hasn't gone away entirely. And many people, especially the most vulnerable, will still need testing, vaccines, medicines, and more. Before we talk about those changes and those challenges, talk about how we got here. The 80 million vaccines, the 35 million tests that Walgreens administered, and how the retail pharmacy landscape has changed over those last 3 years.
Yeah, it's kind of interesting to look back to think that, just 3 years ago, we were actually in the midst of building our testing program. A vaccine hadn't been created 3 years ago, or the multiple vaccines that are out there. And, the first thing we saw was when the pandemic hit, the role that community pharmacy played was purely a navigation role, coupled with being a level of comfort for the community, because pharmacies were the only healthcare institution open outside of hospitals, and where primary care was taking care of sick people. Our pharmacies were a go-to for many patients to be able to answer questions. I have a cough, where do I go? I don't feel well, what do I do? I need to get my medication. So our pharmacies were open throughout that. And so, when I look back on the last 3 years, the first step was really a sense of gratitude to our pharmacy teams, because when the pandemic hit, we were the ones that were open and our teams were there supporting our communities. And at that time, we had a very strong platform on immunizations. Our pharmacists had been providing immunizations for many years, for 10 plus, 15 plus years. That's where I started my career at Walgreens. And so it was great. We had an infrastructure set up so that we can go ahead and build on that. However, testing was relatively new. When the administration and the CDC and others came to us and said, look, we need to expand testing similar to the way that we're thinking about for vaccines. Are you able to build a program and launch that? And we said, of course, we're going to try, and we'll let you know what we can do and what we can't. And before we knew it, we had nationwide coverage to provide testing services. Our technicians were trained, our pharmacists were trained. And that's what led to having, close to the entire country covered, specifically, like you mentioned, underserved communities, so that we could then be able to offer COVID-19 tests to our patients. And then you fast forward, it wasn't only pharmacists. I think what the pandemic also allowed us to do is expand access through our technicians. We were able to train an additional 50, 60,000 technicians to provide vaccinations and testing services. And, that just means that many more patients were able to be served through our platform. And so, as much as the pandemic was so debilitating for the country, for the world, for us, we were able to see the silver lining of, we have a role to play. We can provide services to our communities to help them get better, to help them make the next best action. And it was great to see all of our team members step up, get trained, and then be able to provide that type of service to our patients.
I was really struck by what you said about all the questions that your team members were being asked. I got my COVID shot at Walgreens on Main Street in my town. People were confused, they were scared, and Walgreens was accessible. Your pharmacists were accessible, and I now think of a pharmacy as being almost the healthcare navigators.
Yeah, they're trusted. Our teams, our pharmacists are trusted within the community, and will provide guidance. Do you need to go left? Do you need to go right? Do you need to see
Mhm.
your physician? We're connected also with the healthcare ecosystem, working with our patients' physicians, working with their nurses, making sure that we're helping to bridge the gap appropriately and sending whatever data we have back to the state registry, making sure that everyone had the same level of information. And so to your point, being that accessible, trusted provider, which we always have been, I think as a pharmacist, we always talk about that.
Mhm.
But with the pandemic, it really came to life. And it's great that we're talking about the PHE ending, because I can tell you about 2 years ago, or about a year, 3 years ago, when this was, coming around the corner, and, we hadn't even had a vaccine, we didn't know when this would end. And so it was the entire supply chain working together so that we could really get to where we're at today.
Yeah, it was an amazing effort. All
Yeah,
right, so the way people get access to COVID-related products and who pays is going to evolve over the next 18 months. There's going to be a lot of changes. Can you
that's
talk
right.
a little bit about those changes, what it's going to mean to the patient and what it will mean to Walgreens?
Yeah, so, if I think back during the pandemic, a couple of barriers were broken down that had always existed. We were able to get scope of practice, consistent across the country. Reimbursement and payment was easy, in the grand scheme of things, because the government took care of that.
Mhm.
And so then when you break down those barriers of, cost, and you break down the barriers of accessibility, then it's a matter of getting everyone to get the service and ensure that there was equitable access to care, and then we could provide that. So now that the PHE is ending, our teams have been working feverishly for the last year and a half to make sure we're maintaining that. We've been working at the state level, state by state, to make sure that we were maintaining access on immunizations and testing, to ensure that our technicians and pharmacists could continue to do so. And in the majority of the cases, we've made really great traction. There might be a handful of states we're still working through, but I would say where we're at today compared to 3 years ago,
Mhm.
very different. We're in a much better spot. We now have been able to maintain that. And because our partners on the government side, our partners across the supply chain, like we said, understood the importance that we had to maintain access to care. And, as a reminder, our pharmacy and many other pharmacies that are out there, but with Walgreens, close to 50% of our stores are in medically underserved communities. And so maintaining access was critical for us, and we wanted to make sure we did that. So our government affairs team have been working feverishly to make sure we were maintaining scope. And then on the reimbursement side, we're working with our payer partners, both for, on the Medicare, Medicaid, commercial side of the house, working with the government on HRSA so that we can maintain access for patients across the board. The IRA, which just recently was approved, and vaccines are covered for Medicare patients. So, I think we're good there. And then it's a matter of getting commercial Medicaid access. And, especially with the downstream impacts of COVID, it's going to be important that we have coverage across the board. And so that's where we all are working together to maintain that, going forward. Commercialization, though, in speaking with the teams, it's going to be another, like you mentioned, 18 months to get through that. And so we're going to be, working hand in hand with all the different constituents to be able to get there.
Well, it's a good thing that a company like Walgreens has the resources to do that. You mentioned supply chain. It goes so underreported. It's kind of like you never miss the water till the well one runs dry, and then it does, and everyone throws their hands up and
I'd love to say it's a Walgreens effort, but organizations like APHA, NACDS,
Mhm.
industry organizations, our government officials, would love to say that it's us, but it's actually the entire industry coming together so that we can solve this, because to your point, we know what's at risk. And if
Yeah.
we don't do this, there could be downstream impacts across the board, both on the immunization side as well as on the testing side.
All right, so last question, and you kind of touched on it, but I'd like to maybe go a little bit deeper if you can. So Walgreens is expanding its role in the healthcare ecosystem. That's the term that you use. There's wellness, there's prevention, there's medication therapy management, chronic care, specialty care, primary care, acute care, senior care. How do you describe Walgreens' role right now? And what could it be in the future?
Yeah, great question. A part of my responsibility is looking at what does pharmacy of the future look like? What are the investments and what are the infrastructure shifts that we need to take to be able to do so? And then when we do that, what are we truly doing, right? Like what is the role, like you had said, senior care, AM care, there's so many different aspects of it. Now, when I graduated from pharmacy school as a pharmacist, I came out with a breadth of knowledge of being able to improve patients' lives of the ones that we serve. But right now, our pharmacists only utilize, a portion of what we graduate with, and what we're licensed to do, just a portion. And so it's been my personal mission, as well as what Walgreens has been focused in on, is shifting the infrastructure to leverage our pharmacists to be able to provide care in a community setting for low acuity services, and then be a navigation point similar to what we had done during COVID. And so we know, as pharmacy, and you learn it in school, you're part of a team. I am, you go on rotations and you're a part of a team with a physician, with a nurse, with a dietitian, a nutritionist. It's an entire team that is set up as a care team to support the patient. And so in the future, and I'm talking about the future being now, in the next couple of months, we are working diligently to remove work from our team members from the stores, and to remove work from the stores by leveraging digital automation, technology. And so by removing work from our stores, our pharmacists are freed up to play that role, provide testing services. We talked about COVID, but how many diabetic patients do we serve every day?
Right.
How many patients have hypertension? The leading cause of why African-American men pass away is not because of diabetes, it's hypertension. And it's hypertension because it's comorbidity with diabetes. And so we need to be able to solve for that. Cardiovascular health is a key component. So providing blood pressure screenings, providing the ability to educate on adherence on blood pressure medication, being able to do MTM, and then when a test result's high, directing that patient to a Village MD location so that they have a primary care if they don't have one already, or connecting them to their health system, a local health system that they need to get help with. The intent is that we would be that navigation of care and leveraging the entire journey of what a patient could go through to help them navigate appropriately, ultimately reducing costs. And so the intent is that we would then extrapolate what we've learned through COVID and extrapolate that into other conditions that we know we can help solve for. Cardiovascular disease, diabetes, like we had mentioned, being able to support various screenings like colorectal cancer, being able to educate around, the importance of an A1C test and why it's important to get, your eye tested, and just the basic information that a patient does need, but doing it through our trusted, healthcare professionals that are embedded in communities across the country.
I love that. Connect, navigate, educate, test, all in an effort to shift infrastructure to leverage care in a community setting. It's brilliant.
Yeah.
Thank you so much for doing this. Let's do it again. Rina Shah from Walgreens. Thank you.
Thank you.